Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. COVID-19 continues to take a toll on our province. Today, we reported 3 more deaths at Northwood and 9 over the weekend. This is a wretched disease, and I am sorry to the families for your loss. I also want to take a moment before I turn over to Dr. Strang to talk about our frontline workers at Northwood. They show up every day and put their lives at risk to protect some of our most vulnerable. I want to tell them how reassuring it is to hear families describe the loving care you, as frontline workers, are providing to their loved ones. Dr. Strang will offer details and a timeline around the response to COVID at Northwood. And I want to assure families who have loved ones still in Northwood, we are doing everything we can. Northwood has been surrounded with specialists, extra medical staff, and cleaning staff. The virus has been in for about 6 weeks, and now we need to continue to do everything we can to get that virus out of Northwood. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Before I begin my remarks, I also want to acknowledge that 9 fellow Nova Scotians have passed away from COVID-19 since we last were here on Friday. All 9 were residents of Northwood, and like the Premier, I want to pass my deep condolences on to their families. We do have 3, part of that 9 is 3 additional deaths that we are reporting today since yesterday's update. That brings us to a total of 41 Nova Scotians who have unfortunately passed away due to COVID-19. We do have 6 new cases of COVID-19 reported today in the province, which brings our total number of cases to 991. Out of that, we have 6 individuals in hospital, 2 of those in the ICU. So that number it continues to drop, which is encouraging. And they're included in the 652 Nova Scotians who have been infected with COVID-19, but now can be considered to be recovered. We've had 30,984 Nova Scotians who have tested and received a negative result. And in our long-term care settings, we have 11 licensed long-term care homes and an unlicensed seniors facility that have had at least 1 case of COVID-19 in a staff or resident. The total number of residents involved is 245 and 113 staff, and the majority of those are from Northwood. I will give in a moment, I will give a more detailed update on the long-term care situation. The QE2 lab continues to have lots of capacity. Yesterday, we did 454 tests. They can do at least 3 times as much as that. So I really want to, we're continuing to look at in an evidence-based, organized way as we move forward into a recovery strategy, how we actually use a detailed active surveillance based on testing to inform that recovery, and we're certainly going to be looking at ways we increase the testing that we do. But we also want to remind any Nova Scotians that who have symptoms that could be COVID. All our assessment centers are still open, and we encourage people to, if they have if they have 2 or more of fever, new or worsening cough, headache, sore throat, or runny nose. If you have those symptoms or have concerns you have COVID, if you're able to use the online assessment tool, please do that. If you don't have that internet access, you can certainly call 811, and they'll give you direction from there. I'll now move into a more detailed update of the numbers we've had in our long-term care homes and the unlicensed seniors facility. Up till now, we have presented cumulative numbers, and as I said just a few moments ago, we've had 11 long-term care homes and unlicensed seniors facilities that have had COVID-19 among staff and or residents. Of the total of 245 residents, 46 of those have recovered, and 39 unfortunately have died. The remainder are still in the recovery process and being cared for within their facility. Of the 113 staff who have contracted COVID-19, 61 can be considered recovered. The rest of them are still within that in the time period of their infection, waiting to reach the minimum of 10 days before they can be considered to be recovered. Fortunately, we have had no staff fatalities among the staff cases. All the active cases that we now have in long-term care facilities are at Northwood in Halifax, and that's a total of 160 residents who are still considered active cases, and 49 staff who are still considered active. We have 2 other licensed long-term care homes and unlicensed seniors facilities that have active cases among staff. There's two individuals in total. So Northwood aside, we've had several outbreaks in long-term care facilities that we've been able to manage, limit the spread, and in other facilities where we have sporadic cases, there hasn't been substantive spread. I think that's testament to, in general, the work that's happened in our long-term care sector and the plans that have been were prepared and put in place. It's important that Nova Scotians understand that as we respond to COVID-19, that our priority has been to protect and maintain the health of Nova Scotians with a particular focus on those who are most vulnerable. And clearly we know, looking at our experience here in Nova Scotia, across the country and internationally, that seniors and long-term care facilities remain at the top of the list of ones who are the most vulnerable for severe disease and dying from COVID-19, and they will remain a particular focus of our attention even as we move into recovery. Protecting those individuals is a top priority. We do know that we've only had the one long-term care facility, Northwood, that it's had a significant outbreak, as I mentioned, and I'll speak to Northwood in more detail in a minute. And again, that's reflected that the protocols, the planning that were put in place have been successful in limiting outbreaks in the smaller type facilities that we have around the province. We know that we're among the first of the provinces that restricted access from visitors to long-term care facilities back in March the 15th. On April 6th, we actually put together a comprehensive set of directives to long-term care facilities based on the prevention steps as well as managing outbreaks. Though the majority of those steps were already in place and were built on existing protocols in place for influenza, but we went a step further, and rather than as guidance, we actually made them directives and then supported long-term care facilities in the necessary and needed implementation of those directives. But ahead of those directives, we know that many of the facilities had already been proactive on their own. For example, Northwood required staff to start wearing surgical masks in all patient interactions on April the 6th, and that was actually 2 days ahead of the Public Health Agency issuing their guidance on the use of masks by frontline healthcare providers. We in turn, Nova Scotia, we were doing an assessment on the supply of personal protective equipment, and that we gave an official directive to long-term care facilities, along with other care providers in hospitals. But for the long-term care facilities, it was a directive on April 13th that they all frontline care providers wear masks. And even prior to April 13th, we had spent the last 2 days prior to that, we were actually distributing masks to long-term care beginning on April the 11th. On April 23rd, we put forward as part of our revised directive that staff that were working in a facility that had an active outbreak would not be able to go work in another facility without self-isolating for 14 days. And that was an important step as well. And we will continue to review those implications. We're looking at our potential requirements requirement for long-term care staff to only work in one facility. We're looking at there are significant implications for that, and we continue to look at that and whether that's feasible or possible. But we're doing as much as we can to limit the movement of staff between facilities, whether there's an outbreak or not. I think it's important for Nova Scotians to understand, if they look across the country, that what they see happening in Nova Scotia, the timing may be different than what they're seeing in other provinces. And that's simply a reflection that each province has their own epidemiology that we're responding to. Certainly COVID-19 does not happen consistently across the province. And so some of our actions were ahead of other provinces, and some of those were behind. For instance, we know that Ontario, Alberta, and British Columbia were ahead of Nova Scotia in implementing the masking policy, and that is simply a reflection of they were 2 to 3 weeks ahead of the rest of the country in their and how the pandemic played out within their own jurisdiction. Nova Scotia, we were fortunate. We were the last province to have a confirmed case of COVID-19, and so we were further behind. But we implemented the FACT masking policy ahead of Saskatchewan, Manitoba, New Brunswick, and PEI. It's also important to understand that our first cases of COVID-19 in long-term care facilities began in late March, and because of the time frame of exposure, that these individuals would actually have been infected in the 1 to 2 weeks prior to that, so around the middle of March, and that again was well ahead of the evolving science around asymptomatic spread, and well ahead of the national guidance that was issued again on April 18th around masking. We know that in an epidemic like this, knowledge evolves. We build our response based on the best available information in front of us at the time, and that we were as evidence evolves and science evolves, we adjust our response. But we can't anticipate where science may go, and we have to respond on an evidence-based approach of what's in the knowledge that's in front of us at the time. We want to reassure Nova Scotians that we, with a lot of hard work led by Deputy Minister Fred Crooks, working across government, working with many business sectors, that we now have a good supply of PPE for healthcare and essential service workers, including masks, and we're involved in ongoing conversations to make sure with our long-term care facilities to make sure that they have the appropriate amount of PPE that they require as we move forward in our COVID-19 response. I'll end up by speaking specifically a little bit around Northwood. And there's no question at all that around the tragic and very serious situation at Northwood. But I want Nova Scotians to know that Northwood and the healthcare system and the provincial government that all appropriate steps have been taken to bring that situation under control. Northwood, in the Nova Scotia context, is a very unique facility. It is by far the largest long-term care facility in the province. It's the largest facility east of Montreal. It has almost 600 residents and 400 staff. Many of the residents there are very frail and elderly, like other long-term care facilities, but making them very vulnerable to the virus. Much of the Northwood building, because of the age that it was built, does consist of shared rooms, and which makes people more the ability for virus to be transmitted. That's just a reality of the infrastructure we have. There are also, by the size of the facility, the 400 staff living in an urban environment. As I've talked previously, urban environments, we have greater likelihood of the transmission of and the spread of COVID-19. So we have large numbers of staff coming from a number of communities across HRM, and some of them their job by necessity facility has them traveling throughout the facility. So all those conditions make Northwood somewhat unique in the Nova Scotia context and made it the opportunity, unfortunately, that once COVID-19 was introduced, it was able to spread significantly throughout Northwood before any cases were detected and before we even were aware that there was an outbreak going on. But I have to give Northwood credit. They have taken all the steps that they could have taken in preparation. In fact, they implemented their pandemic plan back in March the 12th. And as I also mentioned, they were one of the first in the province, even before a directive on April 6th, where they started to require all their workers providing care to wear masks. The first cases at Northwood were detected. The first the first staff was on April the 5th, and they had their first 5 residents detected on April the 7th. They were immediately supported by Nova Scotia Health Authority Public Health, as we do with all long-term care outbreaks. And there was initially felt that the outbreak was able to be managed appropriately. But on April 17th, they understood that they were becoming overwhelmed, and they reached out to the Department of Health and Wellness for help, and there was an immediate response from the rest of the health system and across government to put in the necessary supports to be able to develop and implement the emergency plan that was necessary. We had the Nova Scotia Health Authority, other long-term care facility partners, educational partners, continuing care assistance and training, all who came together quickly to support the necessary staffing needs. The Nova Scotia Health Authority brought in 2 infection control experts to complement what was already in place at Northwood. And I think it's important to recognize that there has always been an appropriate and sufficient supply of the necessary personal protective equipment, masks, gowns, etc., to manage this outbreak at Northwood. So I think we recognize the tremendous efforts that have happened, and like the Premier, want to pass on my thanks to all the workers from a range within Northwood and all the health system partners who have come to their aid, and the unions and other groups. Thank all of them for the collaborative effort that's been put in to do what's necessary and what can be done in Northwood to manage this outbreak. The appropriate protocols were being followed, continue to be followed, and we'll continue to support Northwood as necessary. We are still doing some testing in that facility. The number of cases are decreasing as we'd expected, but we will see some more cases coming over time. It's simply a fact that it takes time for some individuals from the time they were exposed. And one of the things we're learning about this virus in many of the residents, if they initially test negative, that we already know that they've actually been infected, and we can expect that they will in the days to come test positive. Northwood has been taking the appropriate steps that as best they can within their facility to isolate positives from negatives. We're now in the process of being able to move more people resolved out of the facility, and now Northwood has created a unit within their space for people who have resolved them, which is giving more flexibility to that facility to separate people who are known positives from the rest of the population. But it's unfortunate because of what we now know about asymptomatic spread, which wasn't as well recognized and understood even a month ago or 6 weeks ago, that the virus had gained a foothold in that facility, and that what was the preparedness steps that were taken was necessary and appropriate, and we've been able to do what can be done to minimize the impact of the virus in a facility, given the unique circumstances of Northwood. So we have to remember this has been going on for 6 weeks. Many of the residents had already been exposed by the time we actually recognized the outbreak, and it
can take some time for them to go on and develop illness. And some of them, unfortunately, many of them are doing well and are recovering. But we do know that many of these residents are very frail with multiple underlying health conditions, and some of them will continue to get more serious disease. But I think we thought it was important. I want the Nova Scotians to understand that all available steps were taken in preparedness by Northwood. The initial response by Northwood was entirely, appropriate based on best practice around long-term care, infection control, and outbreak management. And then the appropriate steps were taken when the health system response stepped in to support Northwood as necessary. It's tragic. It breaks my heart when I see the numbers every day, but and I really feel for families and individuals. But I want Nova Scotians to understand that the healthcare system has and will continue to take this circumstance very seriously and do what's necessary and what can be done to support Northwood.
Thank you, Dr. Strang, and we'll be happy to take any questions now.
Again, just a reminder, we'll take one question, one follow-up from reporters on the phone in the allotted time that we have. We'll start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, I think, like a lot of people, I'm a little confused. You said that proper protocols were followed at Northwood. I'm just wondering, can you explain how or why a protocol would be to leave a sick elderly patient in a room with another resident who is not sick? I know we've spoken to a number of families who the resident who initially wasn't sick actually got sick and passed away because they contracted the virus from their roommate. Can you explain that process and whether or not that protocol will be changing in the future in light of what's happened at Northwood?
So a couple of things there. Northwood did what it was able to do. Initially, when the outbreak at the start, anybody who tested positive was moved onto their COVID unit. But that was only had a limited number of spots. But also very early on, Northwood recognized that even people who were testing negative, they'd already been infected, and within a day or two were testing positive. So recognize that even if you had two people in a room, one was positive, one was negative, in all likelihood that person who was a negative had actually already been exposed. So you're not putting them at any increased risk by keeping them in the room. Not the ideal thing, but they moved as many people out as they could, and even when people were in the same room, they were kept separate as much as they could. Appropriate infection control was applied. The fact that we have shared rooms is a historic piece within long-term care facilities across the country. Certainly any new facilities are built do not have shared rooms, and that's an issue moving forward into the future. But the appropriate infection control that could be applied within the facility and the physical infrastructure that they have was done and continues to be done.
Go ahead, Natasha, with your follow-up.
Thank you. I know we were slowly starting to reopen things with the parks and stuff being opened. Alberta now has an app where public health officials can kind of track people who may have come in contact with someone who has tested positive for COVID-19. Is Nova Scotia looking at doing that? Can you explain why or why not?
We're certainly in part of discussions. My colleagues in the department who are kind of the leads in our information technology space have been involved with other provinces and territories in national discussions about this. There's a number of potential apps out there. Certainly aware of what's happened in Alberta. Alberta has had a number of hiccups in the last few days around that app. So we're involved in those conversations. No decisions have been made. We're still working to do the assessment of what would be the value add of these types of apps, what would be the appropriate application here in Nova Scotia.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, Dr. Strang, given the uniqueness of this facility and its, the idea that it's older, the way it's configured and the number of people that are there, is it wise in the future to leave it as is, given what may be coming? Are we going to have to rethink how that building at least is configured if we're going to stop a similar outbreak? Because I would suggest that it shouldn't be a surprise to anybody that this happened there. Maybe you disagree. Could you just let me know what you feel about that?
So, I mean, we're dealing with the outbreak right now. Certainly, I'm well aware that of those issues in my conversations with Northwood when they're being flagged for future. How we respond going down the road, the physical infrastructure, the layout is certainly something that's been recognized that needs to be a more thorough look at.
Go ahead with your follow-up, Keith.
This is for the Premier. I'm wondering about border security. I asked you last week whether was there any thought to strengthening enforcement on the border, given what New Brunswick is doing and what Newfoundland announced today. Basically, their enforcement, so-called peace officers, are given powers like they're able to detain people. They're also able to deny people entry into the province. That's not currently the powers that we've given our conservation officers on the border. Again, is there any thought to changing that situation, or are we going to remain the same?
We haven't given any thought to change that. We haven't seen the rationale for it, to be honest with you. The protocols at the border have been working. Some people have gone home. We see Central Service lineup is working well. And then those Nova Scotians that are coming in have to self-isolate for 14 days. People have been adhering to that since we started that. So we haven't seen any reason to increase the powers of people at our respective entry points into our province.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Hello. My questions are for Dr. Strang. First, Dr. Strang, wondering about community transmission, what we're seeing and how you would define it. I'm wondering, for example, community transmission, would that include transmission between residents and staff within Northwood? How does that count? So I guess my question, how much community transmission are we seeing, and how would you define that?
So we define community transmission is exactly what people where there is an exposure that we can explain. So it's not within a household. So initially, many of our cases where people were isolated, their contacts were identified, and they're in the same household group. And if one of the contacts becomes positive, we know exactly how to explain that exposure. That's not community transmission. Long-term care facilities, again, if we can explain the exposure within a facility, that's not community transmission. Community transmission is when we see cases that either we can't explain how they got exposed, so they must have been exposed somewhere, or we know that their only exposure would have been in a community setting amongst other people. So when we pull out households and pull out long-term care, what we're left with is really community transmission. And what we have seen in the last couple of weeks is we've had low levels of community transmission. So today we're reporting 6 cases. 4 of those are community transmission in various parts of HRM. So we're not seeing the significant numbers that we have 3 or 4 weeks ago when we had a much greater concerns, and we're seeing greater clusters of community transmission. But we still are seeing these cases that would certainly show that we're having some level of community transmission, and that's why we need to continue to enhance testing. Anybody with symptoms, we absolutely need to test them to see if they have COVID or not. And we are looking at when it's necessary, as we've done previously, bringing in enhanced testing capacity in some of the communities. If we see further indication of ongoing community within a local geographic area, we will certainly do as we've done previously, and bring in enhanced testing centers in that to facilitate more aggressive testing at a local level if necessary.
Go ahead, Shayna, with your follow-up.
Thank you. Again, for Dr. Strang, in your opening remarks, Dr. Strang, you seem to suggest that there really wasn't a way to prevent these deaths at Northwood. But we know that Northwood has, a workforce where some people do have to hold down multiple jobs. There are double rooms, of course, in Northwood. Respectfully, are you saying that 35 residents died and there was nothing more we could have done?
No, I'm saying that all the necessary steps that the tools we have available to us. So we work with long-term care facilities every year around influenza outbreak. It's a respiratory virus. So that was a starting point where we actually, from the very early in January, February, we were working with our long-term care facility partners to make sure that they were aware and were fully able to operationalize their respiratory disease outbreak plans, and then we've turned those plans, made them more COVID specific, made them more directive. We've required now the use of masks. So it's not that we were saying nothing could have been done, but I'm saying the appropriate things that could be done to minimize the introduction and to deal with an outbreak if it happened have been in place and continue to be in place. One of the first things we did, as I said, we were among the first provinces to actually restrict visitors. As challenging that may be, separating individuals who are residents from their families, we knew that was necessary to minimize the chance of virus being introduced into a facility. We also stopped residents coming out of the facility doing on community visits. Again, that puts a lot of burden on the residents, but we knew very early on that we had to minimize the chance of virus getting introduced into a facility. And that remains true because once it's there, it becomes harder to manage, and because some of the unique circumstances around Northwood about the way it was introduced and then some of the ongoing challenges with Northwood, it's made it very difficult to control that. And the virus before it basically had been spread throughout the facility before we even recognized that there was an outbreak going on. But I don't want people to think that nothing was being done. We were doing everything that was entirely possible to prevent and then respond to the outbreak.
Next, we'll go to Ashley Field from Global. Go ahead, Ashley.
Yes, hi. This question would be for Dr. Strang. So you said that masks were made mandatory for long-term care facility workers on April 13th here in Nova Scotia. We know that other provinces like BC, they made that mandatory back on March 25th. I'm just wondering why it took so long to make that mandatory here in the province, given we knew that COVID-19 would eventually reach our province.
So they made that choice because they were in the middle of some outbreaks. Certainly the science that supported that wasn't necessarily very strong at the time, but they went ahead and made that choice. I was involved in a lot of discussions in the last couple of weeks of March into the first week in April around what was the evolving science around asymptomatic spread. And it wasn't until that April 8th date that the Public Health Agency of Canada felt that the science was strong enough, and we actually came out with a statement to that effect. And we then implemented a masking policy within several days of that fact guidance. But we were anticipating this, and as the Premier has talked before, and I also have, we knew this was likely coming, and what the work that was going on behind the scenes was to actually develop and assess what our current supply at the time of masks and other personal protective equipment was, and develop some plans both in terms of working in with a federally led procurement policy, as well as some very fast and work here within the province to bring businesses and other sources of PPE alongside. So that work had to happen before we could actually come out with a policy. There's no point in having a directive if you don't actually have the supply. So we were doing a lot of that work before the federal guidance in anticipation of that coming, but we also had to let the science come to a certain point. And we were ahead of a number of other provinces but at the time that we implemented that masking policy.
Ashley, do you have a follow-up?
Yeah, so I guess I just want to confirm that it was a supply issue, and also if this would have been implemented earlier, do you believe that it could have saved lives?
No, it wasn't just, as I said, it was both understanding the science, waiting to get some further clarity on the science and what was the effectiveness of masks, as well as we were anticipating what an answer might be, and we were in anticipation of that developing the appropriate supply. So it was a combination of ensuring we had the right supply, plus following carefully the science as the science evolved.
Next, we'll go to Olivier Lefebvre, Radio-Canada.
Merci beaucoup, Tina. My question is for the Premier. The NSGU is calling for a public inquiry into what happened at Northwood once the pandemic is over, saying it's the best way to learn out of this. Will you support that?
We're working very hard with Northwood, with unions across the province to ensure that we deal with COVID-19 in our province, and we'll continue to focus on that.
Go ahead, Olivier, with your follow-up.
Yeah, again, for the Premier, last week there's a coalition consisting of university professors and unions asked in an open letter for a few things, mainly for increased financial support from the federal and provincial governments and no staff cuts, lower tuition, and increased financial aid for students because they fear that the pandemic may have bad repercussions on higher education institutions. Is it something that you plan on doing?
I'm extremely proud of our universities in our province and our community college who have, over the last 6 years, helped us transform our economy, invite new Nova Scotians, new Canadians, help us continue to increase our population, drive innovation. And I want to thank the administration and those that work at those universities for their collaboration, and I will let the administration manage and run their universities.
Next, we'll go to Frank Campbell from the Chronicle Herald. Go ahead, Frank.
Good afternoon, Premier McNeil and Dr. Strang. This question is for the Premier. The mother of your cabinet colleague, Tony Ince, recently passed away at Northwood. First, do you have a comment about Thelma Coward Ince, a role model and pioneer? And what more can you say to Mr. Ince and the loved ones of the 34 others who have died at Northwood from COVID-19?
I spoke to Tony the day that happened. The minister was very proud of his mother. I had the good fortune of knowing her through many, both professionally when in events I was at, but socially, I adored her. She was such a I watched her glow with pride in her son, and I know how much Tony admired the strength of his mother. She grew up at a time when discrimination was rampant, and she continued to find her way to set many markers for herself, for women in this province, and quite frankly for all of us. And her character kept her in good stead, and her great sense of humor. In the latter part of her life, she spent time in long-term care, and with the many health issues that she faced, she continued to keep the love of her family around her. She continued to provide support to them with her sharp wit. And I passed on my condolences to Tony. I passed on my love to him. We've been together for a long time and good friends. And I know what it means to lose a parent, and he knew that all of our colleagues were with him, and we continue to be that. And it's my hope that all of those families who have lost a loved one through COVID or the tragedies that have taken place in our province feel the love from all of us. These have been difficult times, and losing someone from your family for any reason is difficult. So I want them all to know that we as a province are mourning with them.
Go ahead with your follow-up, Frank.
No, I do not have a follow-up. Thank you.
Great. Thanks, Frank. Next, we'll go to Katie Hartite from News 95.7.
Thank you. If the province does ask for a review of how it managed the coronavirus pandemic, will that be set up so the public can watch the proceedings?
We're walking through dealing with this issue now. We've been sitting here for almost daily, providing updates, providing information. Northwood's provided information. We really are focused on ensuring that we continue to chase this virus down all across the province, particularly in Northwood. And I want to thank those many unions who have actually provided support and have been focused on solutions. and that's what we're continuing to focus on. And we will continue to put all of our energy and our effort in ensuring that we continue to work with the hardworking frontline people at Northwood, those that have come in to support them, to ensure that we provide the best care possible for those residents.
Go ahead with your follow-up, Katie.
Earlier today, I spoke with the president of the Nova Scotia Federation of Agriculture, and he said next to healthcare, farming should be a priority for all levels of government because it is an issue that impacts everyone. Today's announcement from Trudeau was really a drop in the bucket when compared to all that farmers need help with. Is there any talk right now in provincial government about more support for our food producers and processors?
So we've continued to provide support. Minister Caldwell has been constantly working not only with the agricultural sector, but with the fishing community. Continue to provide support, ensuring that temporary foreign workers have come in, providing support around the farm loan boards, fishery loan board, and deferrals. Continuing to work with them to ensure that the planting season will happen and that our critical food supply continues to go uninterrupted, and we will continue to partner with them. And the minister will continue to liaison with them and bring back solutions and ideas to our government. If there are things that we can do with them, of course we'll do that. But the national government made an announcement today, and I'm sure all of the agricultural sectors in our province are looking at how they best fit into those, and Minister Caldwell will work with them to ensure they have the proper information.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Last week, the province opened parks and some services with very little notice. Can you say at what stage the province's plan is at, when it will be made public, and given that businesses need time to rehire staff and arrange PPE, will they be given notice so they can prepare?
So we announced, and I think it was pretty clear that we were focused on people's mental health last week. I've said to you, to all of you, this has been a tough couple of weeks in our province, not just COVID, and we were concerned. And I was pleased to see the activity this weekend. Part of what we also announced on Friday was that Dr. Strang is working with the associations that represent many of the businesses you're referring to put protocols in place. At the same time, we announced on Friday that Minister Delory and the Deputy Minister will be working with Nova Scotia Health Authority, the IWK, to look at how can we start opening up our healthcare system to do day surgeries or short stay surgeries, and we will give them ample notice. But I think it's critically important, as we're seeing across the country, that we engage the associations that represent these businesses, because some of the openings have not gone as smoothly as people would have liked.
Go ahead, Lindsay, with your follow-up.
Yes. Can you tell us who exactly is working on the reopening plan? Are there specific deputy ministers involved, outside consultants, anyone from the private sector? Who exactly is advising the government on how to do this properly? And once again, when can we expect this?
First of all, as I just said in my first answer, Dr. Strang is working with the outside associations, starting conversations with them over the weekend and today to talk about what public health protocols look like. Over the last number of months, Deputy Minister Miller of Business working with Labour and Advanced Education, and both Minister Kasoulis and Minister McClellan have been active on those files, looking at, first of all, programs that we provide to support, and then working with those associations on what steps they may need government to do to help them open, and quite frankly, the steps they're going to have to do to decide whether to open their businesses or not. And that will have to be where we follow the advice of public health protocol, and that's why we're engaging them now. I am pleased to tell you that there's been a lot of work already, a lot of recommendations, a lot of proposals from active associations. Restaurant Association, for example, provided a pretty detailed map on how they see what reopening looks like to them. We have seen the Retail Association provide us with protocols around to be able to follow public health protocols as they remained open. So there's been a lot of work with them. We'll continue to engage them, and that is a file that I'll be actively involved in. It is one that, as we start to look at opening up this economy, we'll take all of the advice from within inside of government, but we are certainly reaching out beyond government and looking for ideas and support on how we can safely reopen the economy to ensure that when we do open it, that we don't have another relapse and have to tighten up controls again.
Next, we'll go to Daryl Cole from the Amherst News. Go ahead, Daryl.
Hello, Mr. Premier. Question I have is regarding the economy, and I know Cumberland County's economy is really tied closely to that of New Brunswick. When the economy does open, will there be any coordination with Premier Higgs in reopening the border between the two provinces?
That will be ongoing when we do that. That probably won't line up with when we start opening up our economy. As you probably heard, the Premier today is talking about tightening up controls on both the Nova Scotia and Quebec border for them. But we will continue to be engaged with New Brunswick and our sister provinces across the country when the economies of our province opens up. But I don't. At this point, I don't believe that border will be opened up as at the same time our economy opens up. Bearing in mind, the commercial activity right now is coming across our borders. We've allowed trucking, bringing goods and services in. So what you're referring to really is the shopping opportunity that each New Brunswicker into Nova Scotia or vice versa, or some of the workers that have already been able to cross back and forth. That will continue.
Go ahead, Daryl, with your follow-up.
You might have already answered this question, Mr. Premier, but when do you expect the economy of Nova Scotia to begin reopening?
So we started this weekend looking at, as I said, opening up parks and issues. We're starting conversations with associations that represent small businesses. There has been ongoing work with inside of government through different committees with the Chamber. I know through the Department of Business. I've been actively involved on with some of the organizations, but it will all determine. Public health will determine that. Our epidemiology will determine when we go forward. What we've said and the work we're doing right now is reviewing some of the plans that these associations have brought in, having them reviewed by public health so they can tell them whether or not they will pass, or here's other things you have to do to meet the public health protocol. Just like this past weekend, we said to our parks, start getting ready, go in and do the work, let your employees go in and do the work. We said the same thing about golf courses, get out on the golf courses, prepare the golf course for operation. The conversations that we're doing with these associations will be just that. Here's the public health protocols you have to follow. Start preparing your business to be ready when public health deems it's possible for us to open up the economy.
Next, we'll go to Evan Taylor from CKBW Radio. Go ahead, Evan.
My question is for the Premier. I was wondering, this is the first time we've had a chance to ask you questions since Friday and the weekend, which had a very nice Sunday on it. I was wondering if you could comment on the observations or what you heard about how Nova Scotians handled the easing of restrictions.
So I heard lots of positive comments. If I can tell you, the visuals were probably as most important for me, which was the smiles on faces. Where I saw there were family units that were out in parks. So there were people out walking. I heard some media reports this morning where people talked about their mental health and how much that improved, and that was ultimately our goal, was to provide Nova Scotians with this opportunity, and they accepted the challenge, and it quite frankly made me feel good, and I'm sure it made Dr. Strang feel good. It's been now 7 to 8 weeks we've been here tightening down protocols, and to be able to see Nova Scotians out moving around our province was a positive thing, and I was beyond happy considering the amount of sadness this province has seen.
Go ahead with your follow-up, Evan.
My follow-up is for Dr. Strang. I saw Northwood was hiring immediately for various positions, and I was wondering, are there certain challenges and precautions that need to be taken when bringing in new staff to a facility going through a situation like Northwood is?
So I'm sure they'll have the appropriate training and orientation necessary for people, so they can actually come to start working in a manner that protects their health. So they're well versed in whatever the necessary personal protective equipment they need for whatever their job is, as well as the appropriate infection control steps. So that for anybody working in a long-term care facility needs to adhere to minimize the transmission prevention of a range of diseases, and then some things that may be specific for COVID. So I have full confidence that all that necessary training will be in place. They've already done some of that as they brought in staff from other facilities, making sure they're oriented to Northwood, and that would continue for any new staff they'd be looking to hire.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. As I said in my previous question, how happy I was to see so many Nova Scotians out enjoying the outdoors, walking our trails or hiking in our parks, fishing. I've seen some great photos of fish caught in our province over the weekend. We're driving golf balls, and you gardened. By all accounts, you kept your distance. And I and Dr. Strang both want to thank you for that. As the weeks continue, Dr. Strang and I will be talking about what's next. He is in discussions with various associations that represent small business to help them prepare for the protocols that will have to be followed when the time to open our economy up is here. But we are not there yet. We need to be safe, and we need to be sure that we are protecting Nova Scotians. But I like the path we are on. But we need to continue to follow the public health protocols of washing our hands and keeping our distance. And so, as we make decisions on opening our province slowly and surely, you have proven to us and to each of you that we can do this together. I've always believed in you, but after this weekend, I believe in you even more, and I know that we can find our way out of this together.